Okay, welcome back to Bounce Around Charleston. I have with me Dr. Dalila Lewis. She is the program director of child neurology and the residency program at the Medical University of South Carolina. Dr. Dalila Lewis, welcome to Bounce Around Charleston.
Thank you. It is my honor and pleasure to be here to speak with you today.
Okay, there's a whole lot going on in our society with COVID 19. Then you have the Delta variants. And myself being a pastor, I'm dealing with a whole lot of situations with the adult members, but now with their children. And we want to talk about the pediatric side of what we're doing for the children to be vaccinated and get themselves ready just to really operate back in society. What do you have to say about that?
Well, I am thrilled that we now have a vaccine available for our younger children, the 5 to 11-year old age cohort. Our children are particularly vulnerable, and unfortunately, South Carolina is leading or close to leading the rates of COVID hospitalization rates for children. Um, and so, with the advent of the vaccine being available for our younger cohort, I'm really urging and advocating my patients and families and the community to get vaccinated. And for those in the adolescent population who have not yet been vaccinated, to get vaccinated as well. It's the single best thing that we can do, and that as a parent, that you can do to help protect your child from this potentially deadly disease. And again, South Carolina is second in the nation with regard to rates in children and hospitalizations. And with the vaccine now being available for the younger children, it really is imperative that we take advantage of what we can do to protect our families and protect our children.
So now I'm understanding that there are alarming rates in reference to the cases of the children that are now on ventilators and situations in the hospital.
That's absolutely correct. And as a pediatric neurologist, we are also seeing neurologic complications as a result of the comorbidities with the with coming down and having COVID, and coming down with the illness, not only acutely, but also kind of in the so-called long haul range as well. And again, our children are vulnerable and represent a vulnerable population. And unfortunately, with the rise in cases, we're also seeing a rise in hospitalizations and seriously ill children in the intensive care unit on ventilators and on extracorporeal membrane oxygenation, which is ECMO, which is something that's beyond kind of ventilation. And so it is a real risk. And unfortunately, we are seeing some serious illnesses and comorbidities.
And so, are we looking at this in reference to African Americans and the Hispanics?
Absolutely, absolutely. If you were to compare vaccination rates of people of color, children of color, compared to non-communities of color and our Caucasian and white counterparts, not only are the rate of complications higher, but the rate of vaccination, unfortunately, is lower as well. And as a person of color, again, I strongly advocate for our communities being vaccinated because, unfortunately, because of delays in access to care and delays in presentation, unfortunately, communities of color are disproportionately impacted by becoming ill and are more likely to present with serious illness and serious complications compared to non-persons of color.
And am I correct to say that those who that have been vaccinated, it's like, okay, you can start moving back into your normal routine?
It's definitely a step in the right direction. Absolutely. I mean, and I'm so thrilled again that we now have a vaccine that's available for our younger cohort of 5 to 11-year-old, because it means that maybe we can have a normal Thanksgiving and a normal holiday, a normal
Yes.
Christmas, again this year. We can gather together comfortably with our families for reunions and for all of those things. That being said, it is still recommended to wear a mask indoors in particularly in schools, because of still increased risk. And so, yes, it is a step in the right direction. Definitely, it is something that will make us all a lot more comfortable, and seeing our families, hugging our grandparents, hugging our uncles and aunts and children and nieces and nephews, and kissing our babies and all of that. But definitely in regions and in areas where the vaccination status is unclear, or there still isn't at risk, the recommendation is still to wear masks, and in high risk areas, and still specifically wearing masks indoors in schools.
What do we do to dispel the myths about the hesitancy about taking the vaccine?
Absolutely. I think that it just can't be overstated that the vaccine is safe. It was not created in a vacuum. It's not new technology. It is science that has been tested and has been verified. And here we are, a year later, and I know I got my vaccine. I was one of the first people to, as a healthcare worker, to get my vaccine. I'm still standing, and so I think that when you compare the risks of becoming ill and hospitalized and dying compared with the risk of getting the vaccine, there really is no argument no valid argument to not getting the vaccine. I think that certainly in communities of color, there certainly can be some wariness about being approaching a new technology, or being felt to be kind of a guinea pig with regard to new medical technology and devices and that kind of thing. But this is something that is, kind of population wide. And again, I would state that the risk of dying and risk of having a serious illness far outweighs any concerns about complications or issues with getting the vaccine.
So, is there anything that we should be concerned about in reference to children taking the vaccine? Or is there anything we should be concerned about?
Well, I think that it is something that people who have underlying heart conditions certainly should speak with their physicians and their doctors and their healthcare providers to talk about whether or not the vaccine is something that is indicated for them. But really, by and large, even those who are immunocompromised and have underlying conditions, the risk of getting a serious complication with COVID and ending up on a ventilator is far, far higher than the risk of having a complication associated with the vaccine. So I would say that if there are any questions about it, if your child has any healthcare condition, just to speak with your healthcare provider about it. But don't not get the vaccine thinking that, oh, my child has an underlying condition, so I shouldn't get it. Just speak with your healthcare provider about it.
And what about, okay, there are some people that I talk to, especially my congregation. They are avid flu shot. They get that flu shot. The other shots that they get normally every year, is it okay to get them all?
It is. I am so glad you asked that question, Pastor Miller. So, so first of all, also advocating for making sure your children get the flu shot because flu season is upon us. We saw alarmingly low rates, thankfully, last season. But this time around, again, I think that we will see a resurgence because people are getting together again and that kind of thing. And so absolutely, there is no contraindication to getting the flu vaccine and getting the COVID vaccine simultaneously. There had been previously some talk about kind of waiting 2 weeks between getting COVID vaccination and then getting the flu vaccination, but that has now been recognized that if there's no need to wait, that it is absolutely safe to get your COVID vaccine and flu vaccine at the same time or within a close time frame. There is no need to wait for that.
So which vaccine is being given to the children?
So the Pfizer vaccine is the vaccine that has been approved and it is now being distributed. And the dose has been tailored for the pediatric age group. So it is not the same dose as an adult or adolescent, older adolescent would get. And it is the Pfizer vaccine. So 2 series that are given a minimum of 21 days apart.
Now, one of the questions I have for you, Okay, I was at a conference this past weekend, and every day when we walked in that conference center, we had to take the COVID test.
Mhm.
Is there such thing as too many times of testing? Or
Absolutely not. Test away, test away. So no, there's no such thing as being over tested or too many tests or anything like that. Um, and I think that depending on the setting and the requirements of conferences and institutions and that kind of thing, and some people's job requirements, they have to get tested when they travel and that kind of thing. So absolutely, just follow the guidelines of your institution and the location that you're going.
so, what is the final word you will say to our listeners and our parents out there about their children being vaccinated?
I would say the best Christmas present you can give yourself is being safe and healthy. And what you can do to make sure that you have a part to play in that is getting your children who are eligible vaccinated against COVID and against flu. We want to have a safe and healthy holiday season and gather together with our loved ones and do so safely. And so I would strongly urge you and encourage you to get the vaccine yourselves. And if you have not as a parent or caregiver, and also get your children who are 5 and up vaccinated as well.
Dr. Lewis, Bounce Around Charleston says, thank you very much for being with us today, sharing valuable information about the importance of getting your children vaccinated. Thank you so much.
Absolutely. It was absolutely my pleasure to talk with you this afternoon.
Okay, you heard it right here on Bounce Around Charleston. We'll be right back after this break.